Good evening, ladies and gentlemen. My name is Akina Odum, and my presentation today is on moral right to healthcare. Introduction. As healthcare administrators, it is our duty to ensure that healthcare providers follow their organization's policies and procedures and federal laws to achieve maximum patient satisfaction and safety. Unlike every other right of Americans, the right to healthcare is mostly dependent upon the availability of resources. Code of Ethics. Code of ethics is the set of standards of ethical behavior which is required for the execution of health services from healthcare professionals to their clients or patients. Code of ethics is necessary because it serves as a guide to help healthcare workers to behave in certain situations regardless of how right or wrong they may be. The hospitals should set up an ethics committee so that workers that have reasonable grounds to believe that their colleagues violated the code can report them to minimize or even eliminate unethical behaviors at the lowest level. Healthcare providers have to explain every procedure or action they take on their patient to enable them to be aware of the choices they have to make and also get the opportunity to know that they made the right decisions themselves without any wrong persuasions. Resource allocation. For resource allocation, it is quite hard to meet the needs of every patient and still please all of them. With that said, it is imperative to make careful decisions when allocating them. There are two ethical questions to ask to achieve a meaningful outcome. When it comes to the question of meeting the procedural justice allocation, the first thing to consider is the six essential characteristics of procedural justice. These characteristics include impartiality, reversibility, transparency, consistency, voice, and accuracy. When a healthcare provider considers all of them carefully, it will make the action they take fair and just. The best way to be fair to everyone is to prioritize and acknowledge that people that are in similar situations will receive similar treatment, and those in different situations will be treated differently too, by Bastelos 2013. For instance, if a patient with a chronic condition without insurance is sitting in the emergency room for a while due to lack of funds, and another patient with a poisonous snake bite is rising for treatment, and they treat the snake bite patient first regardless of the financial status, the chronic patient is less likely to feel disregarded for two reasons. One is the poison can kill the other patient faster, and the second is, according to healthcare.gov with no date, every patient in the emergency room must receive treatment regardless of whether they have insurance or not. This makes it a bit easy for healthcare providers to allocate their resources without being biased. The second question to ask when allocating resources is if the distributive justice in assigning is reasonable. The distributive justice considers the appropriate way to share the resources by reviewing the type and quantity of goods and benefits available. To make the distribution clear and smooth, following some of the principles like contribution, equality, merit, and so on will serve as guidance. The Stark Law. Congress enacted the Stark Law to protect patients and other federal healthcare programs against fraud, unnecessary utilization of resources, and improper referral payments by April 2013. Every patient has the right to pick their primary care providers, but in situations where a patient's health is in critical condition that requires an expert to make a decision, The patient loses that privilege even though their final consent lies with them. From this perspective, if a physician is making a referral for such a patient and considers his or her gains without looking out for the patient, this is a violation of the Stark Law. For instance, if an arthritis patient requires a simple X-ray imaging to assist with the diagnosis, and the doctor refers the patient to a facility that he or she has an affiliation with and orders an MRI instead of the X-ray for profits in the difference from the payment without thinking about the patient's increased exposure to radiations and only considers the monetary gains, this kind of action violates the law. The penalty for violating the law attracts punishment. According to the U.S. Department of Health and Human Services with no date, filing false claims may result in fines of up to 3 times the program's loss plus $11,000 per claim filed. In conclusion, Healthcare Code of Ethics, Resource Allocation, and the Stark Law are some of the relevant moral concerns to consider when it comes to safety of patients as well as healthcare workers. Following the Code of Ethics keeps healthcare workers in check and adapts the proper approach to situations. Resource allocation eliminates bias and maintains fair and just treatment in the healthcare system. The Stark Law prevents physicians from making unnecessary referral for their own gains. And finally, I have the references listed. Thank you.